Testosterone and diabetes, the hidden connection. In this episode, we'll break down the complex two-way relationship between testosterone levels and blood sugar, and why hormones and blood sugar are far more connected than most people realize. When we think about testosterone, we often focus on muscle growth, strength, and male characteristics. But what if I told you that testosterone is also deeply linked to blood sugar regulation, and that low testosterone can actually increase your risk of developing type 2 diabetes? Let's break down the science. Insulin is the hormone that allows glucose to enter cells to be used for energy. Testosterone plays a major role in how responsive your cells are to insulin. This is called insulin sensitivity. In healthy men, testosterone improves glucose uptake in muscle cells by increasing GLUT4 transporters. It also enhances mitochondrial activity, so glucose is burned more efficiently. When testosterone levels drop, muscles become less efficient at using glucose, forcing the pancreas to produce more insulin, leading to insulin resistance. Low testosterone changes body composition in ways that directly worsen blood sugar control. More visceral fat, fat around the organs, less lean muscle mass, lower resting metabolic rate. Visceral fat is not just storage, it's hormonally active. It releases inflammatory chemicals, or cytokines, that further reduce insulin sensitivity. This creates a vicious cycle: low T to more fat, to more insulin resistance, to higher blood sugar, to even lower T. Testosterone also influences the hypothalamus, the part of your brain that controls hunger and energy balance. Low testosterone can lead to increased cravings for high-calorie foods, reduced energy for physical activity, and poorer regulation of blood sugar peaks and drops. So the hormonal imbalance affects not just metabolism, but also behavior, making diabetes risk even higher. It's a two-way street. Diabetes itself can cause low testosterone. How? Chronic high blood sugar damages the blood vessels and nerves that supply the testes. It also raises SHBG, or sex hormone binding globulin, which binds to testosterone and reduces the free active form. In fact, studies show that men with type 2 diabetes have a 30 to 50% higher risk of having low testosterone compared to healthy men. Several large studies confirm this link. The Massachusetts Male Aging Study found that men with low testosterone were more than twice as likely to develop type 2 diabetes over the next decade. A 2010 study in diabetes care showed that testosterone therapy in hypogonadal men improved insulin sensitivity and reduced fasting blood sugar. However, benefits only lasted as long as therapy continued. Stopping treatment caused blood sugar control to worsen again. For men with both diabetes and clinically low testosterone, testosterone replacement therapy, or TRT, can improve insulin sensitivity, increase muscle mass and reduce visceral fat, lower HbA1c, long-term blood sugar marker, by small but significant amounts. But TRT is not a cure for diabetes. Lifestyle, diet, exercise, and weight management is still the primary treatment. TRT is an adjunct for those with confirmed hypogonadism. TRT may not be suitable for everyone. Risks include increased red blood cell count, or polycythemia, potential cardiovascular strain, suppression of natural testosterone production, and prostate health concerns. That's why medical supervision is non-negotiable. If your testosterone is borderline low and you want to improve blood sugar naturally, strength training to increase muscle mass, losing excess visceral fat, optimizing sleep, reducing chronic stress, and maintaining a balanced diet with controlled carb intake, These changes improve both testosterone and insulin sensitivity, attacking the problem from both sides. Testosterone and diabetes are locked in a feedback loop. Low testosterone worsens insulin resistance, and diabetes can further lower testosterone. Breaking that cycle requires a dual approach, both targeting hormone balance and blood sugar control. For some, that means lifestyle changes. For others, medical therapy is necessary. The key is knowing your numbers, both testosterone and fasting glucose, and working with a qualified healthcare provider to create a personalized plan.